Edutainment Studios welcomes you to Healthy Living with HIV, Commitment for Treatment. This module is part 1 of a 4-part series on healthy living with HIV. HIV can be scary and overwhelming, whether you have just been diagnosed or already being treated. Today we will discuss some valuable information about HIV treatments, what you can do to live a healthy lifestyle, plus tips for working with the doctor. In this course, the objective is to help you state the basic information about HIV, list the stages and symptoms of HIV. HIV, or human immunodeficiency virus, is a virus that attacks the immune system. The immune system is the part of the body that fights diseases and keeps you from getting sick. The process of the infection is as follows. HIV enters the bloodstream and attacks CD4 cells. HIV uses CD4 cells to make copies of itself. The virus moves through the lymph nodes to find and destroy more CD4 cells. Over time, HIV attacks so many CD4 cells that the immune system no longer works like it should. HIV affects the CD4 cells, or T cells, which are white blood cells that help fight infections. It also affects the lymph nodes. These are glands throughout the body that create and store cells that help fight infections. Without treatment, the number of CD4 cells in the body gets smaller and smaller over time. As the number of CD4 cells decreases, you are less able to fight off serious infections and diseases. When your body can no longer fight off infection, it enters an advanced and more serious stage of HIV called AIDS, Acquired Immune Deficiency Syndrome. A number of factors can affect how quickly you can develop AIDS, including age, overall health, and how well you have followed your HIV treatment plan. Without treatment, HIV can lead to AIDS in about 10 years. Taking medication exactly as the doctor prescribes can help prevent AIDS for many, many years. HIV is considered AIDS when either a blood test shows that the CD4 count is less than 200, or you have certain kinds of infections or cancers that affect the immune system, like Kaposi's sarcoma, hepatitis C, or pneumonia. In the early stages of HIV, there may be little or no symptoms. They usually start 2 to 4 weeks after the virus is contracted. Symptoms may be similar to signs of a cold or flu and last for a few weeks. They can also include fever, rash, sore throat, night sweats, and swollen lymph nodes. After early symptoms subside and treatment has begun, it can be years before any other signs of HIV start to show. However, just because you do not have symptoms or only have mild ones does not mean that you are cured. The virus is still active and living in your body, but reproducing at very low levels. The doctor will often refer to this as having achieved viral suppression. This means the viral level or amount of HIV in the blood is so low that it does not show up when tested. This does not mean that you are cured, but that the virus is no longer able to harm your immune system. It is important to remember that the virus can still be spread in this suppression stage, even if there are no active symptoms. However, the chances of infecting someone else is extremely low if you strictly follow your treatment plan. AIDS is the final stage of HIV. At this point, the immune system is badly damaged, and the risk for infections is high. If you have AIDS, you may also have symptoms such as fever and chills, ongoing diarrhea, shortness of breath, weight loss, blurred vision, and memory loss. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 4-part series on healthy living with HIV, and come back for part 2.